Hello and welcome back to the Naked Truth Show, Access to Safe Abortion as a Human Right and Saving Lives Matters series. This is our fifth and final episode of the series, coming to you under the SAfAIDS Transforming Lives program, which is generously supported by Sweden, as well as the My Choice, Our Choice campaign, focusing on ending unsafe abortion in the SADC region. The campaign focuses on creating an environment where adolescent girls and young women can access safe abortion services with the support of community leaders, men and boys, as well as the larger community. When a woman decides and chooses to have an abortion, as more than 46 million women do annually, they must have access to the facilities and care that will enable her to terminate the pregnancy safely, as well as a supportive environment where her reproductive rights are not restricted or compromised, nor her choice and decision-making power taken away from her. Respect for women's human rights to make decisions regarding their reproductive lives is not only limited to governments only, but extends to entire communities and populations, including men and boys in all their diversity as a sub-key population. To help us understand the role of men and boys in supporting choice, we have Musa Hove, who's the country representative of SAfAIDS Zimbabwe. Musa is a seasoned public health, sexual and reproductive health and rights, and gender expert. Musa, welcome to the Naked Truth.
Thank you very much, Shemaine. Pleasure to be here.
Okay. Thank you. Musa, why is it important to have men and boys being part of sexual and reproductive health and rights initiatives, particularly those that also include adolescent girls and young women?
Thanks, Shemaine. And I think broadly when we talk about men's involvement in the broader continuum of healthcare, men don't live in a vacuum. They live in a society that has got children, that has got women, and other subpopulations within that context. So it's important that men are part of the conversation, the discourse around any health matters that affect women, that affect adolescent girls and young women, solely to start with because they are part of the family setup. Mm-hmm. Secondly, it's also important to understand historically and the context that and the influence that men have always had. So it's important that we conscientize men of their responsibility in ensuring that they support adolescent girls and young women's positive SRHR outcomes.
Mm-hmm. Just reflecting on the response that you've given me, Musa. So it's looking at sexual and reproductive health and rights in general, but now when it comes to issues of access to safe abortion, we start to talk about issues of agency, decision-making power, bodily autonomy, and having the respect for women's choices as well as their bodies. Why is it then very important for men and boys to have that full appreciation of why it's important to support choice?
I think the critical word that you speak about is choice. Mm-hmm. Choice is far much ranging. It means the autonomy for one to make decisions in their own, by having formed their own opinion and having been informed by their own undertakings in terms of what is right for them. But we live in a community and we live with social influence, cultural influences, religious influence, and many other various influences that we have in life. And we understand that historically sometimes those choices have maybe been either undermined or sometimes, and in other contexts, not available at all to subsections of our adolescent girls and young women. So why it is important for us to have that agency with the inclusion of men is ensuring that they are supportive of women's adolescent girls' choices in making those decisions. Historically, we also understand that laws, policies, structural environments have not been supportive of those choices. And fundamentally, you've seen, and we've seen it again being perpetuated with the previous government that was in the States, where decision-making around women's sexuality and choices was being made, unfortunately, by men, very powerful men. So I think this is the understanding that we now need to sort of foster within our own context to start understanding and bringing men on board to have real and meaningful conversations, particularly looking at the impact of not having a choice for a young girl, for women, for any other subsect of the female population. Because it's important that we, as a country, as a nation, as a region, we move in a standardized way that promotes choice, but also that understands the impact of the lack of that promotion of choice, not just on the healthcare system, but at a more individual level in terms of mortality rates and so forth, because we've seen the extent at which unsafe abortion and the mortality rates are so interlinked, and I don't think we can continue with the status quo.
Musa, you speak of men in powerful positions making decisions. So now, how do we strike a balance between having men and boys within the safe abortion advocacy space, as partners, as supporters of women and girls' choice, and preventing, toxic patriarchal systems encroaching into these spaces and still continuing to limit women's reproductive freedom?
The issue of patriarchy is a societal-wide thing. It's a global epidemic of very varying proportions depending on which part of the world you are, but it exists everywhere. In Zimbabwe, unfortunately, we're also not spared by some of the harmfulness or toxicity of patriarchy and how it exists. But what the conversation for me should always be is how do we create allies in men for them to be able to be supportive of this clear public health agenda that we want to focus on. And for me, I think it starts with the engagement processes and not to try and put men on a pedestal and try and get them to have a sense of right to be in that space. But it's about engaging them in a meaningful way where they understand their responsibility towards the whole national and regional and ultimately global picture in terms of the advancement of women's rights, especially when it comes to choices. Patriarchy is a system and it's learned, and by so doing in its nature, anything that we have learned, we can also unlearn. So I think we need to really emphasize whether it's about information dissemination, whether it's about raising awareness, whether it's about creating champions within the sector that also focuses on men, and that men can also speak out from community right to the macro level in terms of policy, decision making and legislative instruments that can also support this agent or urgent need of change.
Thank you very much, Musa. Some very important points being raised. Join us after the break as we continue this conversation. Welcome back to our second segment. Today we're talking about how we can galvanize men and boys as supporters of adolescent girls and young women's choice and agency. Joining us today is Musa Hove, the country representative of SAfAIDS Zimbabwe. Musa, welcome back to the second segment. Okay. So earlier you mentioned, men in power or leaders, powerful leaders. So then how do we motivate, male leaders? Because if we look at the world that we live in, largely still patriarchal, like you mentioned, and most of our leaders are male. So how do we motivate the leaders within the different sectors, political sector, traditional, religious, health and justice sectors, to catalyze some of their actions and responses to issues of unsafe abortion?
I think it's like what I stated before. I think it's about building an alliance of men that understand their responsibility and understand why it is important for them to be able to support the cause of choice, of free choice, especially when it comes to sexual reproductive health and rights for adolescent girls and young women. And I think part of the process includes really understanding what men's thoughts, attitudes, perceptions are around, depending on the quarters that you're in, the sensitivity that they have around this particular issue. And I know that there's been a lot of moral, religious objections that have been raised. But statistically, when you present arguments in terms of pushing or advancing the morality or moral argument vis-a-vis the very clear mortality rates that occur on a daily basis in the country, within the region, globally, women that die, girls that die because of holding up this moral argument, I think you start having a shift in the attitudes and perceptions of these men. So I think we've had the Guttmacher Institution that has been presenting a lot of the statistics that we rely on in terms of decision making. And I think that we need to also ensure that when we present such matters, they are presented with the statistical backing so that people start to seeing the human face behind this political consciousness or this moral consciousness that they claim to have. So it's always important for me, I think, if we start having allies that are there, champions that are there, that can be part of this whole movement building that we're trying to create. And I think great examples have already been set through the SADC model law in terms of what we should be doing, but that in itself is not important. At country level, at subnational level, at facility level, it should really ring right through the whole continuum of healthcare for women.
Mm-hmm. But for now, how do we get men and boys, to support women and girls' access to safe abortion information as well as services, within our current context where we have restrictive policies in place, and also with mobility being compromised, with the COVID-19 pandemic?
Mm-hmm. Men must, face up to the fact that they don't live in a bubble. They don't live in only a men's world. This world consists of all the subsets of the populations that you've just spoken about. And I think it's key that we start to understand our own responsibilities in ensuring that we see the world that is not just free of disease and infirmity, but that is also promotes rights, responsibilities. And if you look at it from a human rights perspective, I don't think a lot of us men would be happy if we had any privileges taken away from us. So why is it that we sit comfortably when we talk about other people's privileges being stripped away from them? So I think it's part of the difficult conversation that we need to have, but have it we must. And one of the key things that we need to do is to really ensure that we engage men wherever they're found. I even promote going to have discussions with men in a beer hall about the need to promote sexual reproductive health and rights, because ultimately, if we only end the conversation at a macro level, we're not really making impactful, meaningful change where it is really, really supposed to be. And that is within communities, that is within families, that is within an individual's attitudes, perceptions, and ultimately their behavior in promoting choice.
But Musa, how readily available is the information, for men and boys? I know we're talking about them being able to support, to have a full appreciation of the issues that we're talking about. But how readily available are the statistics, are the stories to men and boys?
So this is where we fundamentally need to change a lot of the work that we do, Charmaine. For us as women's allies and activists, as men that have gone through that transformative process, I think it's not enough for us to just have these conversations at macro level, as I spoke about. How is it that we're reaching those young boys and girls that are growing up in the very marginalized communities in this country, in this region? How is it that we're trying to influence how they should grow up understanding why it's important for them to support SRHR needs for women and girls? So these are the real tangible outputs and outcomes that we should really aspire for. And for me, it really starts with us having a responsibility and ensuring that we design and we hold government to account for programs that really look at getting to the grassroots and eventually to the crux of the matter. And I think if we have that deliberate application and deliberate accountability movement that says to government, these are the problems and these are the issues that we're facing at community level. If we continue doing the same and holding conversations at a much higher level and not really doing any undertakings at community level, then we're just going to see the perpetual cycle of unsafe abortion and the unfortunate mortality that it also comes along with.
Thank you very much, Musa. So I'm going to ask you in the last segment, to really elaborate more on your call to leaders, what we can do differently. Join us after the break as we continue this conversation.
At 16, Alice was not ready to have sex with her boyfriend, but because she wanted to stay together, she found it hard to say no when he pressured her. She asked her healthcare provider for contraceptives, as the law allows, but was shamed for having sex and was turned away. Later that year, Alice became pregnant. Alice was not ready to be a mother, and because she was afraid of being judged and turned away again, she sought the help of a stranger who said he could help. Alice had an unsafe abortion and became very sick afterward. The doctors later told her she almost lost her life. Alice isn't alone. Thousands of adolescent girls and young women like her may find themselves seeking unsafe abortions, accounting for over 10% of maternal deaths. Why? Some, like Alice, face stigma and judgment from healthcare providers, family, or friends. Many don't have access to sexual and reproductive health services, including contraception. Some are survivors of sexual assault or have abusive partners. Some never received comprehensive sexuality education, and when reproductive health care, including safe abortion services, are difficult to access, it puts their lives in danger. Alice's story shows how unsafe abortions are dangerous and can be deadly. Her story didn't end in tragedy, but many others do. Providing access to safe abortions is how we as a community put the lives and well-being of our sisters, mothers, and daughters first. Policymakers must be proactive and change restrictive abortion laws to save lives. To learn more, visit SAfAIDS.net. My choice, our choice.
Welcome back to our third and final segment as we continue to discuss how we can galvanize men and boys to support women and girls' agency when it comes to issues of access to safe abortion. Today we are joined by Musa Hove, the SAfAIDS country representative for Zimbabwe. Musa, welcome back.
Thanks, Shami.
Just lastly, Musa, what is your key message to men and boys, in the communities, at national level, even across the region?
I think the key message is responsibility. And once we understand our responsibility in promoting good sexual, reproductive and health rights outcomes for adolescent girls and young women, then we start to become real allies towards meaningful change in country and within the region. What is always lacked as being men that stand up for these universal rights in the right platforms to really galvanize not just the message, but galvanize other men to be able to join and become allies of promoting that agenda. So I think it's important that in as much as we do great work at a macro level, at a policy, at a government level, it's also equally important that we look at the implementation of the policies at subnational and at community level, because without which we are not going to see the desired effects that we would like to see. So that's my key message, that let's become responsible, let's become allies, and let's really understand what it means for our sisters, for our mothers, for our girl child, not having the enjoyment of your full human rights as they're supposed to be.
And just in conclusion, what is your call to action to leaders and in our diverse sectors across the SADC region?
I think beyond the rhetoric that we have seen, there's got to be followed with meaningful action. I think we've seen over the course of the years how lowly the barometer has ranked matters of advancements of choice, advancements of human rights, especially when it comes to subsects of our population. So I think we need to really move from rhetoric to practice, from theory to practice. And my biggest call is for our leaders to really ensure that we have measurable change, and we can only do that by setting up and allowing budgets to be able to track progress towards this, and if those progress markers are not met, devise meaningful actions to ensure that we A, catch up, but B, also ensure that our programming is reflecting to the needs of our communities. We need to do this in a very structured way. We have ratified a lot of policies, we've ratified a lot of treaties and charters. The Maputo Plan of Action is one such, but we need to really see its implementation and rollout to its full effect.
Thank you very much, Musa, for joining us and for that very strong call to action, moving away from just speaking about it and making commitments towards actually catalyzing the actions on the ground. Thank you very much for joining us today.
Thank you. Thank you, Shemaine, for having me.
Okay. Thank you very much to Musa for that very strong call to action and also just elaborating for us some of the key actions that we need to take on the ground to ensure that we galvanize the support of men and boys towards improving access to safe abortion for adolescent girls and young women. Thank you for joining us. This is our 5th and final episode. Thank you very much for being part of the special series of the Naked Truth Show, Access to Safe Abortion as a Human Right and Saving Lives Matters, brought to you by SAfAIDS in collaboration with Bayete Development Institute as part of the flagship My Choice, Our Choice campaign under the Transforming Lives program, which is generously supported by Sweden and aims to create or contribute to a SADC region where adolescent girls and young women can access free from judgment, safe and legal abortion services. Remember, support choice. Thank you.